So if anybody get the cardiac related chest pain, so here we have to rule out the in this one, so we have to check the what type of the pain here. So what type of the pain, what are the characteristics of the pain? So what characteristics, so on where is the site, so radiations, so is there any radiating pain, any provocations, so any aggravating factors, onset, how it started, and also associated features. So these things we have to rule out. So we are going to discuss one by one what is the characteristics of the pain and site, radiation, and provocation, and also onset, associated features. So coming to the associated like a characteristics. So what are the characteristics? So what type of character? So how the pain? So is it the dull, constricting, or choking, or heavy? So if the pain is going to be dull and also choking and also heavy, like a squeezing and crushing and also burning and also aching. So sometimes they may feel the how they beat with a hammer on the chest, so they are going to feel that much of pain symptoms. And also breathlessness. So breathlessness because of the decrease the blood circulation, so may chance to get the breathlessness, or maybe it's a discomfort. So is along with if they're having any like a pallor, pale skin, heavy sweating, or nausea and vomiting, anxiety, crushing chest pain, breathing difficulty. So this type of characters they may chance to get during the chest pain. So we have to differentiate if anybody having these symptoms, so we can predict this having related to the cardiac chest pain. So coming to the site, so where exactly they're having the chest pain. So is it center of the chest, or is it because the right hypochondrium or left hypochondrium, or in the epigastric levels, or maybe in the left heart pain, or maybe right side. So it depends upon the site. So it may be is a vary. So if it's related to the like a chest or cardiac related to chest pain, so they are going to get the pain in the center of the chest here. So center of the chest, they are going to get the pain. So it's going to because of the derivation of the nerve supply to the heart and mediastinum. So that is the sympathetic cardiac nerves, that is the T1 and T5, the mostly dorsal root going to be involved. So it's related to the center pain. So they are going to feel in the center. So in case of like in the gastric pain, it may alter, it may in the gastric epigastric levels, but may the radiating pain may comes to the in the chest, in the upper chest, or maybe into the in the diaphragm region, in the may chance to get the left is the hypochondrium level. So these things are going to be happen. So and also next thing is we have to check about the radiating pain. So is it radiating pain, so radiation to the neck or jaw, upper, or even the arms also going to be affected. Occasionally the sides radiation is going to be back also, so that means it's going to be the jaw, and also it's going to the neck region, and it's going to the back, and also it's going mainly supply is going to the left shoulder. So because of the irritation of the nerve root, so may chance to get the left shoulder pain. So it's if you see here, so the pain in the center, and it may affect to the jaw, and also affect to the left shoulder, and also affect to the epigastric level. So these we have to find out where the pain is radiating. So if we understand where exactly the radiation is there, so we can easily rule out the is it the cardio-related cardiogenic chest pain or non-cardiogenic chest pain. So next one is the provocation. So this provocation is going to be sorry, yeah, I'm sharing again. Okay, the provocation, the angina pain, or maybe the angina is going to be so during the exertion and also promptly relieved by the rest. So if the anginal pain, so angina is due to decrease the blood supply to the heart muscles. So because of these things, may gives the chest pain. So during the exertion time, R is going to be promptly relieved by the rest. If they take the rest, they may chance to get the less pain. The pain may be is expected by emotions, but occurs more is going to be is readily by the exertions. So or in case of the large meal or cold wind, also they are going to get the severe pain. So that is because of the anginal pain. So in case of like a is a MI, like in the myocardial infarctions, so they may they won't get any rest, the pain relief with the rest. But in the angina, they may chance to get the rest, and also in case of it may affect with the exertion and also large meal and also cold wind. And next one is the unstable angina, also the crescendo angina. So this also similar pain by the precipitated by the maximal exertion or at the rest. So they're going to get the pain in the exertion period, or may also in the rest also they may chance to get. Decubitus angina. So that means depends upon the positions. So we increase the venous return or preload by lying down can provoke the pain in the is going to vulnerable patients. So this is going to be in case of the position change also they may chance to get the pain symptoms according to the venous return or maybe preload. So these are the provocations we can find. And also onset. Onset means so when they are going to get the start with the pain. So this, if you see the myocardial infarction, so the pain of the myocardial infarction takes several minutes or longer to develop. So it takes slowly is going to be developed. But in the angina, this pain is going to build up gradually in proportion to the intensity of the exertions. If they exert more, if they stress more, so the pain is going to be increased. If they take the rest, the pain is going to be subside or is going to be less down. And also in case of aortic dissection, massive pulmonary embolism and pneumothorax, the pain very sudden and also is instantaneous. So that means going to be in case of sudden severe chest pain. It may be because of the breakage of the blood vessels. Breakage means the opening of the blood layers that may be leaking from the blood layers because of the aortic dissections. Or maybe is the pulmonary embolism. If the blood rupture, the blood clot rupture, and also it transfer from the one place to another place in the bloodstream. If they stuck at one particular place, so because of the stuck at the blood vessels, it may won't supply the blood circulation to the other parts of the tissues. So it may use the like hypoxia may produce the chest pain. So that also if the sudden chest pain, it may won't give the cardio related chest pain. And also that is the difference between the MI, that's myocardial infarction. This is the purely like a cardio related chest pain. So this going to be the it takes the several minutes and longer to develop. So it's going to be take slowly they're going to develop the pain. So if the sudden means it's not a cardiac related chest pain. And also musculoskeletal and also psychological pain occurs after the exertions. So exertions means if they do the activities or if they strain. So if they may get the pain means it's related to the musculoskeletal and also psychological test. So psychological related the chest pain. So in its associated features, the associated features are going to be, just now we discussed if anybody having cardio-related pain or chest pain, the associated symptoms are going to be, the autonomic nervous system is going to be disturbance. So because of the autonomic system involvement, they will get the sweating and vomiting and also nausea. Nausea means the vomiting sensation. So some people may chance to get the vomiting sensation as well as may chance to get the they get the vomiting. And also breathlessness. So it's going to be the pulmonary congestion. So the lung is because of the congestion from the transient ischemic left ventricular dysfunction. If any problem in the left ventricle, if there is no pumping action, so they may because of the decrease the blood supply, if there is no pumping action, so they may chance to get the breathlessness. So these are the associated features along with the cardiogenic chest pain.